Welcome, everyone, to another episode of the Health Made Simple Show. I'm your host, Dr. Bart. This is episode 268, and we're going to dive into a topic here today about lipids, better known as cholesterols for the human body, what their purpose is, what do they do, why is there so much conversation, so much attention being brought to lipids nowadays, which I think is a fantastic thing. And then my real goal here today is to simplify it for you, because the truth is that when we start talking about lipids, it's usually in a place in your life, 40, 50, 60 plus years old, going to the doctors. And this is a major emphasis always of where are your cholesterols? What are they at? And then the typical response to that. So I'm going to clear all that up the best that I can. We're going to keep it simple in the same theme that we typically have here in Health Made Simple Show. That, remember, folks, this is it. Health is simple. I'm not saying that it's easy in with that, but it is easy. I'm sorry, it is simple. Health is simple. The concepts, the things that we need to do, how we move, how we eat, how we think, all of these are steady, they're foundational. The challenge is sometimes we get in the way. Sometimes we misinterpret what the body's supposed to be doing or wants to do. Sometimes we just have habits that don't necessarily align with being healthy. And today, just another one of those conversations of helping us better understand this topic of lipids, this topic of cholesterols, because the challenge is collectively over the long haul, I don't think we get it right. I don't think I was taught it properly. This information is taking a long time for me to understand and comprehend a little bit better. And what I mean by that is that, like you, many of us are often taught about, well, your cholesterol is getting too high, too low. We'll talk about those numbers in a moment. And then we were very specifically given two labels, good cholesterols and bad cholesterols. Today I'm going to clear that up and help you redefine what those is. And that's a hard part. That's very difficult to take something that is just inherently programmed into every doctor out there, every patient out there, that there's good guys and the bad guys. What are my bad guys doing? What are my good guys? I'm going to help reposition those because if we understand what the role of cholesterol is, maybe we'd have a different perspective on how quickly we may be trying to deter it or inhibit it or keep it from building up, etc. All right, with that being said, folks, keep doing your thing. Keep sharing out, keep spreading love. I appreciate that you're here listening to the podcast. I appreciate and trust the time, energy, and effort you put just to be with me here today. So I'm going to do everything I can in the shortest period of time to continue to simplify this so you can getting on with living your life the absolute best that you can. And remember always that health is simple and that we were designed to be awesome, frankly, and that your body is a self-healing, self-protective mechanism, that the power that made the body heals the body. And it really doesn't happen any other way, and that all healing happens from the inside out, from above down, from the inside out. The power that made the body heals the body. And from that, let's dive in here. So let's talk cholesterols. First, I want to give you some statistics, which is a little bit concerning. So right now we have over 35% of the adults in the United States are on a statin drug. So that's 1 out of 3. It's more than 1 out of 3. So think about that. 3 adults, 1 of you are on a statin. That's a lot of people, folks. This is the number one drug year after year after year in our country, which is up just a decade ago, so like 12%. Now it's up 35%, which inherently means this. Either we are just missing it or are humans getting sicker? No. Our lifestyles aren't as good. And I think there's just this ease of moving into this hypnotic state of if your cholesterol is a little bit high, without really diving deep into it at all, if it's a little bit high, just go on a medication. Now, you might think, well, that's a good thing. We're going to be saving lives. And yet we got to look a little deeper in that statistically. And this is why we have to have these conversations and maybe take a different perspective and know it. In no time am I telling you, come on or off your medications. I'm not treating you or diagnosing anything here with your podcast today, but really just opening up our eyes to another perspective, another understanding, another learning about lipids and cholesterols, and basically flipping it upside down on its head. All right, so here's why all of these statin taking policies and procedures and recommendations may not be so great. And it comes down to just the numbers. We still have the number one cause of death in our country is heart disease. Over 900,000 people every single year in our country alone die from heart disease. And many of these are already using statins. It just tells us maybe this isn't the right formula. Maybe this isn't the right strategy to win the game. Maybe this isn't the route I want to take, the route you want to take. And so with those statistics alone, maybe we should open up our eyes. And that's what I'm going to help us do here today. And listen, are there side effects from statins? There are. I don't really think that they are significant enough to say, hey, listen, you're going to have all these side effects. There are some real ones, and I'm going to go through this. So probably the most common side effect that we notice clinically, and again, I've been in practice for a long period of time. I've watched this day in and day out. I have a lot of people that are very active in their 40s, 50s, 60s, and beyond. Pickleball, golf, tennis, all the above. And if there's a consistency or a common thread of side effects, it's probably muscle aches and sores. Have we seen some evidence? And I think there's some data and research suggesting that some statins, I'm not going to use a name because I'm not 100% sure on it, but some statins, we see a frequency of things like Achilles tears and issues with pulled muscles. I don't know that that's always the case. I don't think those are really common, but they are associated. No doubt about it. And I don't think, like other medications, I don't think they're the bad thing about statins is the immediate side effects you feel. I will get into what I think is the problem inherently by throwing a statin. And every time we see a marker a little bit higher, a little bit low here. So statistically, 1 out of 3, more than 1 out of 3 Americans right now, adults, are on statins. That's ridiculous, folks. We're not made that bad that we need drugs to manipulate how the body works. And really the way these medications work, they go to the liver. Your liver is what's producing and storing your lipids, your cholesterols. That's where they hang out. The LDLs, the HDLs are all hanging out there. And it inhibits the liver from being able to make these cholesterols. So with that being said, hear me out now, because this is what should open our eyes. When we really ask ourselves, what is a cholesterol? Like, why do we have so much attention to it? This is where I think the premise, the root cause or the root understanding has been completely missed. So cholesterols inherently are building blocks. They help us make cell membranes. So all of your estrogens, which are building blocks, all of your testosterone, which are building blocks, all of your hormones are made from the root of them are made from cholesterols. So imagine now if you took 1/3 of all the adults in our country and put them all on a statin, which essentially is almost saying, I'm going to put you on a hormone lowering medication. That's not what it is, I know, but I'm saying there is a correlation. We're going to inhibit what your body needs to make your hormones. More importantly, what I want you to think of is, and we're seeing this more and more in functional medicine as the data and the research keeps pouring in, we keep looking at cholesterol. Maybe this is one of the most miraculous and overlooked and undervalued components of the human body. It is a magical component which literally helps us heal. It protects us. So now let's go into a little bit of the conversation of the good guys and bad guys. So this is what we have. I'm going to try to simplify this. We have cholesterols, and then we have tools that transport them from your liver out into the body so we can use these tools, these cholesterols, to heal. When it's going from your liver out to your body, those are called LDLs. When they're in your body and you're bringing them back to the liver, those are called HDLs. So somewhere along the way, we gave LDLs a bad rap. And the rap was because if you saw more LDLs, inherently what that meant was that body was trying to do more healing. And let that sink in for a moment. If you see more LDLs, it inherently means your body is trying to heal. So does it make much sense? This is the part we just got to open up our minds and our eyes and say, then does it make much sense to reduce the very thing that is trying to help the body heal? And I know there's arguments here. So, well, doc, what if we have a buildup of LDLs? You're right. That's a problem. That means we're not listening to the body. Maybe we are putting things into the body or doing things to the body that's creating so much damage that your body needs lots and lots of these things called LDLs, these transport agents to deliver the cholesterols to the parts of the body that are being damaged. And where do we see that mostly? We see it in the arterial wall. Then we just go a step farther. So what is damaging? Why do we need so much LDLs in the arterial wall? And folks, it's real simple. It's because of the food we put in our body, or I should say the toxins we put in our body. When we're constantly putting processed food, carbohydrates, sugar, it's damaging the arterial wall, that endothelial lining on the inside of the arterial vessel. It damages it. So the body goes, oh, it's damaged. We need to heal this. What do we need? We need cholesterols. How do we get it here? Well, why don't they catch a ride with LDLs? They're hanging out in the liver. So we tell the liver, this innate wisdom of the body goes, hey, buddy, you got to start to heal. Heal up these vessels. Otherwise, things are going to leak out and maybe cause a heart attack, maybe cause a stroke. So let's heal these walls up. And if you keep damaging them, day after day, year after year, decade after decade. Maybe that LDL has to build up like just mounds and mounds of duct tape. And that's a problem. That's when we start to see the plaquing on the arterial wall. So is that the bad guy? It is absolutely not the bad guy. That is your body trying to heal itself. So with that being said, and what I'm about to say is not, I'm not trying to be derogatory to any other providers. I'm not trying to poke holes or punch. I'm not trying to do that, but I'm trying to just help us all understand that it's time for us as patients, as providers. So the providers listen to this. Our patients are getting smarter and smarter, and they should be questioning our positions on some of these long-standing but maybe incomplete philosophies and approaches toward health. So listen, if your doctor is still looking at your total cholesterol and saying to you, hey, looks like it's getting a little bit high, to be smart, we should probably go on a low dose of this statin medication. Quite frankly, that's coming from a very ignorant position. And I don't mean that in a derogatory way. I mean ignorant, just they don't have the information. They're not updated with what we now understand. And I tell you this, there's going to be other things coming down the road really quick, especially now with the advent of AI. We're going to see more and more data come out to us. And this is what I want you to understand, that yes, super high levels of LDLs is not a good outlook. It's not. So I'm not playing it off and saying high LDLs is okay, but we have to look at the individual who has those LDLs. And as a practitioner, as someone who runs thousands of labs, lipids specifically, very deep, and I'll get into what labs you want to be looking at. What we start to recognize is the labs, to make them important, we have to know the human that has those labs and their particular lifestyle. So for example, here's what's really mind-boggling right now. Well, it's not mind-boggling. It's actually not mind-boggling at all. It actually makes perfect sense, but it's throwing this concept of LDLs being bad and we have to lower them at all costs. It's throwing it upside down on its face and on its head and just kind of beating it down while it's there. So we're starting to see some evidence that some people with higher LDLs, I'm not talking super high, I'm not talking 300, 400, 500s, but I'm talking elevated. Maybe you're in the 150s, 170s, 180s, 130s. They consider normal like 100 or below. We rarely ever see that because your body's always trying to heal. But anyways, we're starting to see these elevated LDL markers with low triglycerides actually be a sign of longevity. And if we see those numbers and we know the patients, this is where your provider becomes so important for you in understanding who you are. And I will tell you, across the board, my people who eat really good and they're super active, that they're my athletes, you and me, the ones that are working out, 4 or 5 days a week, you're just an active human being. You're breaking down tissue, you're building it back up, you're playing tennis, playing pickleball, you're out there, maybe you're doing some CrossFit, maybe you're playing sport or tennis, whatever it may be, you're golfing, you're breaking down, building up, breaking down, building up. What they're starting to see, and they're starting to say, is it possible that for these healthy people with the lower triglycerides, triglycerides essentially will be driven up by all the bad foods, bad lifestyles. So if you have low triglycerides, is your body becoming so innately and in tune with who you are that is providing a nonstop healing source of delivering these LDLs with these new fresh cholesterols nonstop because you need them nonstop? I'm leaning in that direction of thinking this is exactly what's taking place. And again, this is the spot where I say non-interference. Get out of the way. Let the body do its job. Now, that same person with elevated LDLs but has high triglycerides and they are a couch potato, we have an entirely different conversation. But for you out there, many of you are already in this category where, and how do I know this? Because I see your labs all the time. If you have elevated LDLs and your triglycerides are in good, healthy spot, what is that? Definitely under 150. But if you're around 100 or below, that's rock star status. That tells me right away you're not waking up to pancakes and cereal and muffins. You're not drinking much alcohol, if any at all. And I see these all day long. So I see these low-level triglycerides and these higher levels, mid to higher levels of LDLs. And now we're starting to see that this is a longevity pattern. In fact, we start to see that there's a pattern amongst older people having elevated LDLs. And at first, it scratches your head. Why do older people have LDLs? You know why? Because their body's having a harder time repairing. It's breaking down. Yeah, the tissue's breaking down faster. It's having a harder time recovering. The body's trying to preserve itself. It's trying to heal itself. So it starts to take the cholesterols from the liver and it sends them out to the body parts, to the muscles, to the tendons, to the cells that need repair, to build up the outside layer of those cells so we can continue on in this thing called life. So it's trying to send them out more readily, more rapidly. So we see people that live longer often have elevated LDLs. So if we just step back from this, we go, man, we got 1/3 of all of the adults in our country on cholesterol lowering medications. Are we really helping out here? And I think it's very simple. And I think AI is going to help us move fast to say, listen, you can't just judge a book by its cover. We can't just look at your levels and then immediately determine whether or not you need medication. We have to look at you, the human, the lifestyle. And with that being said, often I'll hear, well, your dad had it, your grandpa, everyone in the family had it. So we're also learning very rapidly that we have a lot of ways to understand and test things like genes and, yes, genetic codes and all of those good things. And we're also discovering very fast that your genes play less and less a role in your outcomes, less and less a role in your overall lifestyle, less and less the outcome in what your disease patterns will be. What matters the most, 95% of the outcomes you're going to get is through your lifestyle, folks. So even if you've been diagnosed with, you have this gene or that gene, do not let that like sink in there and be like, oh, poor me, I'm destined to be this. I'll give you a quick example. A very common gene out there that a lot of people are familiar with, something called the MTHFR gene. And this gene, I happen to test positive for it. My wife tests positive for it. We're super healthy human beings, etc. Now, if you have this gene, one of the things they would tell you symptomatically is that maybe you can't methylate your B vitamins and your mitochondria. You're going to have a lack of energy and have all these lists of symptoms that go with it. But what we really discover is this, that you can have the MTHFR gene and never, ever have any of those symptoms unless we interfere. And interference, especially if you have the MTHFR gene, interference is diet. So if you are consuming foods that contain things like processed vitamins, or you have fortified vitamins where they literally spray the vitamins back on the food, you're like, Doc, what are those? Cereals, bread, muffins, pasta, chips, all of these things that are bleached out and kind of dead foods. When they fortify them back, where you see like it used to be like promoted as a good thing, fortified milk, fortified with vitamin D. No, folks, that's a fake vitamin D. Those are fake vitamins and nutrients. If you have the MTHFR gene and you are eating processed foods with fortified vitamins, you are then going to interfere with that methylation, and you will raise the potential of all the symptoms that people here talk about. So what do? Clean up your diet. Don't eat bad food. Eat real food, and you're good to go. My point being here is this. Our genes, 5% or less of determining our outcomes, 95% of the time, it is going to be on lifestyle. So with that being said, if your doctor looks at your total cholesterol, here's where it gets really kind of wonky. If they look at your total cholesterol and be like, oh man, it's getting up a little bit. You're at 215, 220, whatever it may be. Do not fall into the trap there. Do not fall into the trap and use that total number. Frankly, most of us that are practicing on this side of it, meaning functional medicine, we're really looking at an integrated approach here. We don't give much value to your total cholesterol. It's really the breaking down of those cholesterols that matter. So I want to share with you now a little bit of clinical insights of what I see when it comes to cholesterols. I do see some associations to the muscle achy sores, especially if I'm doing a real good history and I see the correlation of when did you start the statins and the person's already been active. So it's not achy sore because of their activity, but they used to do their activity and now they've gone on a statin and they start to see the muscle achy sores. And it makes sense, folks. It is going to inhibit the amount of the cellular membranes that we can make. It potentially can inhibit the amount of good hormones that we're going to make. Do I see achy sores associated? Yes. Some of the more recent things that I've been paying attention to and looking at is when people go on statins and then they start to experience things like brain fog and maybe even mimicking some of the symptoms with Alzheimer's and dementia, some of the neurological diseases out there. I do see a correlation there. I'm not saying causation, folks. Also, I'm raising a red flag here. I'm raising a red flag because we do know when it comes to brain health that your fatty acids and cholesterols are one of the most important elements for human health when it comes to our brains. And if we have a diet that's full of carbohydrates and sugar, we know that dehydrates the brain and inhibits the absorption of fatty acids, cholesterols, the very thing that your brain is made of. And then if you go on basically an anti-cholesterol medication, which is basically an anti-brain protection medication. We're seeing more and more correlation. Don't confuse that with causation. It's not a one-to-one, and it's not one of those ones where you see someone go on a statin and then all of a sudden create all the symptoms of Alzheimer's. Have I taken or have I suggested people to consider coming off of medications, especially their statins, and see their brain fog go away? I have, folks. So I'm paying attention. And this is what your practitioner should be doing with you and for you. Do I do that and just say, hey, you just have to come off this medication? No, it's not my job to take you on or off a medication, but help you develop a philosophy and an education that understands how the human body is designed to work, try not to create interference, and what lifestyle changes you can make to enhance the potential of your body. Basically, it means so you can be a better human being. Now, let's talk diet for a second here. This is where I think if your practitioner is still, they look at your cholesterol levels and they're saying, oh, back off on your eggs and your meat. If you hear that, folks, and again, respectfully, they're ignorant. They're ignorant in their recommendations for what they're telling you. And I don't mean that disrespectfully. I just mean that they just don't know. They're ignorant to understanding what we do know about good, healthy cholesterols from good, healthy foods, that your body needs them. And your cholesterol, your body, your liver is going to help us make cholesterols. And if you don't eat it, it just makes more. And if you eat some, it just makes less. But eating cholesterols will never be the problem. The healthy cholesterols from your eggs, from your red meats, etc. Those are not going to be the issues with driving too much cholesterol that your body doesn't need. Rather, here's where it gets really tricky. If the average person is told not to eat eggs and not to eat red meat, what are they going to eat more of? And the answer is carbohydrates. More bread, more muffins, more pasta, more potatoes. And what happens when we do all those things? We start to create more inflammation. Why is the body inflaming when we eat those? Because the sugar is damaging to the arterial wall. That is the simplicity of it. The bad food creates bad reactions in the body. Then the body has to heal from that. It heals with cholesterol. So it sends LDLs carrying these cholesterols, these transport agents, out to where the body's been broken down. And then the body heals up. And if you want the LDLs to go down, stop putting the junk in your body. That's the simplicity. And that's where I do think that there's still a fair amount of ignorance taking place. And the good news is, people like you, people like myself, you're becoming more and more educated by listening to podcasts like this, by listening to other podcasts, by watching social media and creating awareness around these topics and conversations. And I think as we continue to do this, we have more and more opportunity just to continue to level up our opportunities to just be the best version of ourselves. And again, non-interference is still one of the best methods of having a good, long, strong life. All right, with that being said, now let's shift gears here. So what do you do? So in this is what we do in our office. We test. Let's not guess, let's test. And there's very specific tests that we do. Of course, you're going to look at your cholesterols. And I'll make sure there's a link here below that we do a comprehensive male panel. We do a comprehensive female panel. I like all the markers. I like to see everything collectively at once. So then I can put that together with you and my history of you and our conversation. And we make a very, very personalized plan of what becomes the single most important thing we should address in your health, but also taking everything into consideration and creating a plan. I'm not just talking about this week, this month, this year. What are the strategies you're going to employ and work on? Because health is not a quick fix. It's a relentless pursuit of moving yourself in the direction of being the best version of yourself. Because we always have this thing called age we got to deal with. All right, with the labs, there are a couple of things we look at. I love to see the particle sizes, and which means that we want to look at the small LDLs. That's one of the most important things. Those small LDLs, that's when it gets a little tricky. If the small LDLs start to elevate, there's a little bit more risk factor. So just looking at your total cholesterols and the levels of your LDLs is not indicative of your risk factor. And that's what we want to know. Like, why would we even consider going on a cholesterol medication? Because maybe there's an associated risk of having heart disease or a stroke if we don't address it. So it is the small particles that become one of the most important. Then I also want to know other things like insulin resistance. If you are walking around and you have developed insulin resistance, which I don't even know what statistically to say here, but probably 50% of the people walking around have some level of insulin resistance, which means we're going to be increasing inflammation systemically throughout the body. And you will see your cholesterols trying to support putting out all those fires. You will see them elevated. So I'd love to see the insulin resistance here. I also like to see things like something called CRP, C-reactive protein. Love to see things like homocysteine levels. I'd love to see even just your building blocks. Like, do you have enough B12? What's your hormone status based on your age? All of these things. Comprehensive female panel, comprehensive male panels. Why do we do this? So we're not guessing, folks. We're testing to apply very specific strategies. And this is where personalized medicine is so important. Personalized healthcare, personalized strategies for you to become the best yourself. All right. Hopefully this is giving you some insights. And I want you to feel good about cholesterol, not bad. So none of that stuff where you're getting rid of like the egg yolks and you're just eating no egg whites. None of that stuff. That's all silly, outdated, kind of ignorant philosophies, ignorant understanding of doing that. So let yourself eat the good, healthy stuff. We want to make sure that when you are eating your meats and your eggs, they're high quality. I'm happy to be sitting on my farm today. If you can see in the background, I got a bunch of chickens. If you sound like you're hearing chickens in the background, it's because you hear chickens in the background. So make sure whatever you're getting, it's high quality meats. Go find out and search out the farmers who are doing things right, the regenerative farming. Go find the chicken farmers who are producing the highest quality eggs with the highest quality feed, etc. So you're worth it. I will tell you that every single time, that you're worth whatever time, energy, effort, and money that it costs for you to become the best version of yourself. We get one shot at this thing. So we might as well do it good. And then I'll also encourage you, if you're looking at things and thinking, well, I'll do that sometime down the road. One thing about the labs is they give us the writing on the wall. And so if you are in your 40s, 50s, 60s, or even beyond that, there's writing on the wall. And sometimes we can see things before they happen. Once they happen, no doubt it's a little harder to take care of, or a lot. So with that being said, keep doing the thing, keep sharing out, keep spreading the love. Make sure you're taking deliberate action for your mind, your body, your overall wellness, and continue the best that you can, giving everything you have to yourself and for yourself. And I'll see you in the next episode of the Health Made Simple Show.